Okay. Dr. Luke, the Stretch Doctor. Look, earlier on there was another video we did that kind of showed the assessment portion of what was going on with Will here. Will came out, actually while we're videoing, getting some of our basic stretch videos done. And he's complaining of pain that manifested right under the lower 12th rib, off the big paraspinal muscles and straight in. Now we know that that spot is very specific to the upper hip flexor connections, okay? Now, one of the complaints, and we talked about it earlier, is, oh, could that be my kidney? Certainly we need to assess that. But for the most part, kidney's a little higher. We don't tend to get the pain in where this is, and he would have had likely other symptoms. So we know after we examined, it's a very specific spot. And so I'm going to show you now a little bit about what we do to try to reduce that, and we'll go through all the stages of how we reduce upper hip flexor connection tightness creating pain. All right, get our towel, fold it the way it's folded. We put it up in the area for padding, a little bit of barrier between you and the patient, but mostly this is a little bit of padding to make the intervention a little less uncomfortable. Okay, so I haven't done any deep tissue stuff yet, so let me just show you where we're going with this. Now, because it's just below the 12th rib and above the iliac crest, you've got a fairly small space in here. So you've got to be cautious of a couple of things. First thing is when you begin to intervene here with your elbow, you need to be very aware where the 12th rib is. Okay? Pressure on the 12th rib, it's a floating rib, which means it's only attached on one side. What does that mean? Tends to be a little susceptible if you get too aggressive with it. So we're going to try to stay away from that 12th rib. Let's overlay the towel. Let's start to come down. Now, this kind of work is done primarily with body weight. We're not trying to push hard with our muscles, okay? Because I'll tell you, if you do 2 or 3 of these in a day, you'll be so worn out you can't get to the end of the day. Not only that, but you don't have as much control over the depth, pressure, direction with the client if you're trying to use muscles. So we're going to try to use body weight, shifting our body weight around to get the angles we need on it. Gives us way more control, allows you to do a lot more in a day without tiring out. So let's kind of get started. We know where it is. It's just below the 12th rib, straight in, upper hip flexor connection issue. So let's do some, I always brace myself on the client, okay? Also brace myself on the table. That way I have total control of my intervention. Now, I like the elbow in this, not in this flattened position, but in the turn position, because it narrows it slightly, allows you to get into tighter spaces a little easier. So what I did is first found the paraspinals with my elbow. I drop off the paraspinals. Now, we don't want to go down, we actually want to go in from here. So fall off the paraspinals, shift your body weight back, and move that elbow into that area. Now, can you feel that already, Will?
Yeah.
Okay, so Will can feel that quite a bit. And I think we've hit right on where he was having his discomfort at this point. So here we go. We're going to go in a little more. Shift your body weight. Now my feet are on the floor, and I'm pushing myself forward and back. I'm not trying to push down with my elbow, okay, and my upper arm. So it's position, stabilize, shift your body weight forward and back. As we come in, he can feel that right in that upper hip flexor connection. And so we're getting a feel for how tight it is, and his is pretty tight. Okay, there we go. Little more intense, little more intense. Give him a little break. Okay, one of the things we know, and again, this is all CST level 2 stuff, because this is a very large part of pelvic and lumbar correction. So what I want to show you now is, typically speaking, when that upper hip flexor connection gets tight, it begins to recruit muscles in the lower, farther down below into the pelvis. So what we always do is when we work this hip flexor upper part, we always then again work those upper rotators of the hip. So let's get into those as well, and let's just see how much he's got. Now, oh, lots of tightness in here, okay? So these things typically go hand in hand. So similar way you approach it. You get your body position, you get your body weight over the client, and then you start shifting your body weight around onto the flat part of your elbow. Certainly when you get in these upper rotators, you don't want to use the very tip of that elbow as much as you want to use this flat part of your arm, because then you can get a pretty clear, a larger, wider area that you can hit on, and they don't get that intense, real sharp pain that you can get when you put your sharp part of your elbow in. So here now we're going to roll. I like to often turn my arm inward and outward, often as a way of getting further into those. And in a minute what I'm going to do is I'm going to explain why these things occur and what they really are. Okay, so here we're shifting body weight, coming in again. Now, so what we're finding out is, let me pull this towel back. We're finding out that the areas that are contracted, and I think I'm going to go over the 3 stages of these contractions. A lot of it's very close to that sacroiliac joint. Now, we haven't talked about SI joints or sacroiliac joints yet. I want to get into the details of that. We do that in CST level 2. Okay, but let's get back into these rotators, because I want to go through the simple fix with this, and not the more advanced fix, because his is pretty straightforward. So upper rotators are tight, up against the SI tight, so we do a little body weight shift into there, more into here. Yeah, the very, very upper rotators are tighter, I should say tighter than the others. Let's get back into that upper hip flexor connection again. Now, the next thing I want to do after this, I want to check the lower rotators of the hip, because quite frequently, depending upon how long he's had this, determines how much recruitment we get down in the pelvis. So let's check the piriformis. Now, you may not have seen the piriformis before. You get into the anatomy book, you see that piriformis is that biggest rotator. It comes from the lower part of the hip itself, comes across, but it's the biggest hip rotator you've got, and it's very important. Now we're talking about flat of the arm again. We're going to find that connection of the piriformis, and again in the advanced training I'm going to have to specifically show you where that is. And now we're going to bring his knee up to 90-degree position, and I feel stress on that thing already. I felt that muscle pop up, and we're going to start trying to rotate his hip. External rotation first with pressure. How tight is that? Pretty tight. Okay, let's go inward. Oh, way more restricted coming in. See how the hip just picks right up off the table. And that's real important to note, because that's going to determine how much it's going to take to correct this thing, or at least to get it reduced so he doesn't have pain anymore. Okay, I don't want to spend a lot of time on that. I just wanted to introduce that and get you to understand that there's a lot that we are going to have to do with this, especially with those more advanced cases that come in and they've got multiple symptoms. Okay, so we've gotten into the upper hip flexor connection, gotten to the upper hip rotators, done some hip rotation. Now we're going to move into, now certainly I will have done this both sides. Important we do both sides. Very few of these lumbar pelvic problems are one-sided only. The discomfort, the pain may present on one side, but we always find problems on both sides. So we're going to do both sides of this, but for the purposes of today, we're just going to stick to the side of complaint. So now we've gotten this loosened up. Let me do this, because this is going to be kind of important. You're probably wondering, why are we getting into the muscles like this? Why don't we just stretch them, right? Well, there are conditions of the muscle in which they lose their ability to stretch. Now, I don't know if any of you folks have ever done any of this stuff work before, but those that have know. They may get a client that says, you know, I stretch and I stretch and I stretch, and by later in the day or the next day, you're like, I feel the same as I felt. In other words, they didn't get any positive progression in their stretching. So here's what happens. You've got, if these are fibers of a muscle under a microscope, here's what we see. This would be normal fibers, right? They contract, they can relax. This would be what we would consider a tight muscle. Still contractible, still stretchable. So it can contract, it can relax, but you can also stretch it. What happens when they get like this is those fibers begin to turn on themselves. Now this is what we call uncontractable, unstretchable. That explains why it's necessary to physically lengthen those muscles before we try to stretch them. We're trying to get them in a condition in which they respond to a stretch and they would also then respond to a contraction, okay? Really, really important points. So now that we've done a little bit of reduction on those muscles and we understand that they're probably in the third stage of contraction, now we feel like we can do a stretch and we're going to have an effective stretch. Now, earlier on in the lower extremity stretches, we talked about the hip flexor / psoas stretch. So I'm going to show you that again because we've reduced those muscle fibers that are in he's complaining about today. And let's go ahead and set up the hip flexor stretch. All right, hip flexor stretch is knee to 90 degrees. Position your towel so that you've got padding, all right, and a little barrier between you and the client. We're going to get one foot up on the table. We're going to go ahead and start to lift his leg. All right, then you're going to slide your quad under his, okay? Hopefully you can see this. I did this on the opposite side last time, might have been a little easier to see. All right, now his quad is resting on mine. You can see he's got a pretty good distance.